It's time for New Wellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good day or evening. I want to first of all, thank everyone for being here. Another wonderful, blessed day that we all woke up and rised to this wonderful occasion. So thank you so much for being here and tuning in to New Wellness TV with your host, myself. And I have a wonderful group of people here in the audience, and I am so excited. This show I take personally to heart because it has to do with the heart. And because of me losing many family members to cardiovascular diseases and having long histories of myself of cardiovascular problems, and I don't now, things can be reversed. So I just want to say this show I'm taking personally to heart. And for those of you that are listening and watching, know that the rate, and we know, of heart disease is affecting women at a very early age, and also we know men as well. But there's factors that we can do. But if we can find out things early in the beginning, an ounce of prevention is better than a pound of cure. If we can find out things early in the beginning, and these tests only take 3 to 5 minutes. So we're going to be doing 2 type tests. But first of all, I want to introduce the people here in the studio with me. I am so honored to have the one and only Doris Mosley.
Thank you, Dr. Lee, and I am so honored to be here.
You are more than just, here today for this show. You're also my spokesperson for women and breast cancer, but that's not the show today.
Yes.
So I want to thank you for being here today and allowing me to be part of something that's so big and so huge and it's going to touch so many lives, and that's your event.
Yes.
Which is the Spectrum International Beauty Expo.
That's right.
And we're there doing the screening. So I'm going to talk more about the screening that we're going to be providing that's going to be free. Now, this is something that could be well over $1,200 a screening.
Wow, that's
so
awesome.
It's more than just the beauty shop stroke that I'm doing this time. And this other second test only takes 3 minutes.
Wow.
And the clients will leave with their results the same day. You'll leave with your results. So if something needs to be done, we need to make changes now. When you know better, you should do better.
That's amazing, Dr. Lee.
When you know better, you do better. And I'm just so excited about this.
But thank you for sharing that with us at our event.
You're the first.
This weekend.
You're the first.
I'm excited.
You're the first.
It takes place this weekend at the LAX Marriott.
Yes.
Yes.
Yes. So, and my second guest, I am honored for her to be here. She is wonderful. Her background is just amazing. I want to talk about the opera of her. I mean, maybe she can do a little something for us here on the air. Oh. But she is an opera singer, but she is here to give her testimony. People always look at that picture of a person having a stroke or TIA or things that happen in their life, and they want to equate that to someone older and not someone younger who look vibrant and healthy and beautiful. It happens in the 20s now. This is happening very, very young. So we're here to, and my guest who's here is going to share her testimony, powerful testimony, very powerful. And to look at her, you would never think this happened to her. But she's going to be sharing hers, and this is Alicia Tennant. Thank you so much for being here today.
Good morning. Thank you so much, and I'm so honored to be here. Thank you for inviting me on the show to share my experience and let everyone know what's going on and how we can prevent other people from having any issues like this.
And you're also a registered nurse, and
yes.
You work with the little tiny.
Yes. I'm a neonatal ICU nurse, and so.
And that's such an honor because it would be hard for me because I have a nursing background too to see the little ones. That was hard. Even in my pediatric rotation, I had problems with because just seeing little people that can't tell you what's going on, my heart goes out to anyone. It's a special nurse to work in that field, and you have such great compassion. after meeting you and knowing who you are.
Thank you.
Great compassion.
Thank you.
For the field that you're doing. So I'm excited that you're here
Thank you.
to share your story, your journey, and just want to talk about what we're going to be offering. One is more structural and one is functional as far as cardiovascular health. And I'm so excited that the one that everybody know that I do is called the Beauty Shop Stroke Screening, and that's done with an ultrasound. So we check the carotid arteries, and it's called Beauty Shop because, and we've had shows on this before, but it's called Beauty Shop because if you have hard plaque in the carotid artery on the vertebral artery, what will happen is if it's hard and you're in the bowl having your hair done, and if it's like chalk looking, and you can see that with an ultrasound. And the company that's coming, I just want to say that, they're coming to do this for me, A&S Diagnostic. His name is Serge. We know him as Serge. And I am so happy that he's going to be there with us providing this free service. And it's another company that's going to be there the second day. Peekaview. The name of her company is called Peekaview because she does ultrasounds also for women who are pregnant.
Okay.
So they're going to be there as well. Providing the service. So everybody I call said, I'm there for you.
That's
so
awesome.
I am so excited. And that's the ultrasound component. So you'll be able to see on the screen right away what is happening with the carotid artery. So again, this is all free because a lot of times people have symptoms and they don't know that, they have a buildup of plaque. They don't have good circulation going to the brain. They feel lightheaded. These things happen. But the saddest thing is silent killers. That you have no symptoms at all. And that's what's so important. You have no symptoms. So that's one component. And that's something structurally that is one thing structurally that we can see right away. So we're not going to have the person you see on the screen there probably. We're going to have Serge from INS Diagnostic with us, which is truly amazing. His company has been with me since day one. So I'm so excited about that. And the second device that I have is a Pulse Max analyzer. Now, the Pulse Max analyzer is on my website at NU Wellness Healthcare website. But the Pulse Health Analyzer, I've been with the company for the last couple of months. I'm still in the midst of going through all of my training. But because it gives you the valuable information right away and your event is coming up, I said, what better time to get the exposure and go over with the clients or the participants to come through that test, the Pulse Plus Analyzer for doing cardiovascular screening. So it is truly, truly amazing. And for cardiovascular health, now this is some of the indications we do this because this test takes 3 minutes. So it is mapping the cardiovascular pattern of your heart for 3 minutes. Now, when we look at certain patterns of the heart, we want to look at, I don't want to go over, someone's head, but we look at the, what is called the PRP, the R wave, when you're looking at an X-ray. Not an X-ray, I'm sorry, an EKG. So it is the pulse wave, and I'm not going to get into that because you would have to see it and know what I'm talking about. But it's so important to not just look at the function or the structure, and that would be the ultrasound. But here we're actually going to be able to see exactly what's going on with the heart, since it's a wave that's happening in a pattern for 3 minutes. The information that it picks up is unbelievable in just 3 minutes.
Amazing.
In 3 minutes. So, number one, I want to tell you that it really picks up a lot on the autonomic nervous system. Now, the autonomic nervous system, like, is a big heading. Under that, you have the and the name of the company is the Cardio Group, cardiovasculargroup.com, if you want to check out their website. It's just amazing what they have there. But under the autonomic nervous system, we have the parasympathetic and the sympathetic. So this graph will show you, as we do the report, what that look like, whether you're in parasympathetic mode or sympathetic mode. Now, why is that important for you to know? Would you like to know why that's important?
I sure would. I'm sitting here in a maze. 3 minutes, but yes, I want to know.
Because we're living in such a time in our lives that fight or flight, that would be your sympathetic mode. Mm-hmm. The fight or flight is where we kind of living in today. Now, there should be balance. It's okay to be in that a little bit because if an animal is chasing you, that everybody kind of use that as an example. or if there's a fire and you need to run, you need that. Your adrenaline needs to pump, but you don't need to live in that mode.
Amen.
Because when you do, your cortisol levels increase, your stress levels increase. All these things happen to you and they increase. So before we even get to the autonomic nervous system, everything is under control of your nervous system. So you look at your heart, your lungs, your vascular, your stress. I mean, every system in the body is being influenced. So we have to make sure. So when a person leaves, they're going to leave with results. They're going to leave with results knowing, where am I with my autonomic nervous system? Because if I'm having digestive issues, that's under my sympathetic nervous system. If I'm having my cortisol, cancer patients, anything that's happening, we need to know. Or I need to know. So you'll walk away knowing a little bit more about yourself. The other component is going to tell me the stiffness and how pliable your arteries are. Okay, so that's really important. Another great component is going to show me your stress. Is it physical stress? Is it mental stress? And just reserve of that your heart. So it'll show me the volume of your heart as well, as far as your left ventricle of the heart, because the blood goes through the body, leaves the left ventricle of the heart. And a lot of times people with high blood pressure, they have what is called left ventricular hypertrophy, hyperplasia. And that's because the wall there of the heart thickens. And when that thickens, you're not getting a good volume of blood going through there. So a lot of times people say, my blood pressure is normal and I feel great. But because they're under so much stress and they have no symptoms. This is why we keep hearing in the news so much now, this person had a heart attack and they died, or they had a stroke and they died, because this was not evaluated. Now, if they knew this was happening, they would say, you know what, I'm going to start getting 8 hours sleep. I'm going to start doing some deep breathing. I'm going to start exercising. These are some things that I'm going to do so that I could be healthy. I'm going to need to pull away from the stressful mode, even if I need to quit this job. If the job is every day causing you stress, this is why some people die on their jobs, and we know they die on Mondays because they're thinking about going to that job and all the stress build up all over again. So some things we just have to pull away from, or take a vacation. You have to do these things for yourself. But when you don't know this is happening, you don't do it. But guess what? Is Spectrum International Beauty Expo, they're going to be able to find out these things. And that's just one test. And I only gave you part of the information, which is so valuable. And some people, I've been doing a lot of testing since I've had the machines since January. And it's been amazing. It also will pick up the heart rate and show me from your heart rate as far as being elevated or low, and pick up artifacts. So those artifacts are arrhythmias. So a lot of times people don't know within 3 minutes how many artifacts or extra heartbeats that you present. Because if it's more than 6, then we need to do some other things. This is not a standalone test. I want to say that right away. It is not a standalone test, but this gives us a baseline of where we need to go. And it gives you a baseline of what you need to do to make some major changes right away. I've helped so many people with this, and it's just been amazing how many people it has totally helped. So I just want to say, and I want to thank the company, which is Cardiovascular group.com. They have a wonderful website, and it's just amazing what we're finding. But it also will give me an area and show me your plaque. So, and that is amazing. So it'll show me based on type 1, type 2, type 3, type 4, type 5, and 6. It goes all the way. So all of that. So they will have a wonderful, and I know you can't see this on the screen, but it's going to give them a wonderful graphed. Okay, can't see it on the screen, but you're going to walk away with all this wonderful information.
Okay.
You're going to walk away with the information, which is going to be very, very powerful, and have the results right away. So like I said, in 3 minutes, you're going to find out more about yourself in 3 minutes and what we need to do to help take care of you. So your epithelial cells are the cells that cover the lining there. How healthy are those cells? So when we go to find out how healthy those cells are, then we can go and find out a little bit more to help you to heal. So just 3 minutes, you're going to find out a wealth of information that could save your life. So you want to bring your family, your loved ones. All the operators should be tested because they're standing all the time.
That's true.
I remember testing one of the operators who was treated, no names, and didn't know her doctor never did orthopedic or orthostatic hypertension with her as far as examination. He did not lie her down, check her blood pressure, have her stand up, check the blood pressure, and then sitting. So it's lying, sitting, and standing to check the blood pressure so that you can know what's happening. So there's a variable there to know with the blood pressure. Now, with all this going on with the heart, if you have anything to come up abnormal here, I can almost guarantee that you have inflammation. Inflammation of your body. So it's important that what I do also in a clinic setting, and a person can order these. I want to put this out right now. If you're on cardiovascular medication or you have joint pain, if you have joint pain, you have inflammation in your body. And you want to know what your C-reactive protein blood tests are. You want to know if you have heart problems with your, what are your homeocysteine blood tests. Very important. Now, if you have left ventricular problems or problems with the left side of the heart, or you have a diastolic blood pressure that's over 90, you want to order what's called a BMP. Now, that BMP is an enzyme that watches the heart to see if you have the propensity of having a heart attack. It's a very simple test. You can order these tests from lifeextension.com. And you want to know your cortisol levels, especially when we're dealing with the autonomic nervous system. And under that, we want to look at the heart rate variability. A lot of people have very expensive machines to do what is called HRV. HRV is something that if we don't deal with HRV to know where you are, and there's some things we could turn around with HRV. So it's all influenced by your heart, your respiratory system, sleep, exercise. All of this is influenced. And a good breathing program is very important. So I just want to say this test has much more than even what I'm saying. It would also pick up if there's some type of hormonal imbalance. We can pick that up in 3 minutes. So what you're going to receive is going to be an enormous amount of information in just 3 minutes. So you won't be sitting there for a couple of hours. You'll just be there with us for a couple of minutes. But what you're going to walk away with is going to help save your life. So I'm going to have my dear associate here with me today, Alicia. I want you to share your experience.
Okay.
Okay.
So this was a year and a half ago, and I was scheduled for work. I worked the morning shift, and I woke up with a headache, and I took something before I went to work, and a few hours later, I noticed started getting lightheaded and a little dizzy, and something just didn't feel right. So, and I felt like I was going to pass out. So I went to my supervisor and was like, I need to go to the emergency room.
And you're very young.
Yes.
You're not even over 40 years old.
Yes, I'm around there. In the
Okay,
40s.
okay.
But
But I want to say, because people always, but you look younger. You look like you could be like 21, 22.
Yes.
And people
yes.
always equate this with people who are older. That's what I'm
Yes.
saying. Yeah.
Yes, I'm in my early 40s. But, and so it's, yes, it's something you wouldn't expect. You know, you're just going about your day, you're working, and
Yes.
I was living a busy lifestyle with work, but I didn't feel I was overstressed. I just woke up when, wasn't feeling the best, thinking the headache would go away. And by the time I went to the emergency
So you did
room,
have symptoms.
I did have symptoms of the headache. And by the time I got to the emergency room, I started feeling my jaw tighten. The left side of my face started getting tight and numb, and that scared me. And the entire left side from my arm all the way down to my leg, the whole left side went numb. My blood pressure is 165 over 118, almost 120 diastolic. It's the highest it's ever been. And they admitted me to the stroke unit. So I was on the stroke unit for 4 days at the hospital I work. And, here I am in my scrubs to take care of others, and I'm the patient, and it was very scary.
Devastating.
I had no idea what was happening. And your blood pressure can go high. You don't even have the headaches or symptoms, And that's so what happened, the brain MRI did not show the actual stroke, but it was like a transient ischemic attack, which is called TIA.
Yes.
And you can have symptoms of the stroke, but I guess mine, they said if it did, it passed quick, where it didn't show on the MRI of the brain.
You're blessed, yes.
I'm very blessed and so grateful. But I was left with the residual weakness in the left hand, so I had to do physical therapy. And it took a while to recover from that, just the weakness and regaining my strength. But making sure my blood pressure was under control, which I felt it was at the time. But I think the biggest issue was a stress that I didn't even realize I had. I was picking up extra shifts, and you go through the motions doing your thing. You know, we have our goal set. We're going to do this and
Yes.
that. And you think you're handling it, and you adjust, and your body adapts to the stressors we put on it. But you don't know how much damage that's doing to your body. If you're not
Exactly.
having all the symptoms to say, oh, my arm's numb. No, that comes later when it's too
Yeah.
late. And that could have been too late for me. So I just encourage everyone to make sure you have your lab tested, know where your carotid artery, what's going on with the plaque in your body.
The plaque, yes.
Know your levels, and eat healthy, eat right, exercise, do all that you know that you can be doing.
And you were doing this prior too.
I was.
But see, we do those things, and I'm like, I have to watch me
Yes.
because I can live on autopilot. You
Yes,
know,
yes.
just set
Just
it,
go.
and I'm gone.
That's right.
And I'm like, you know, everybody keeps saying, "Oh, but you look great," and I'm like, "Yeah, I feel great," but I've been in 2 comas, and the times I was in a coma, I had my lab work pulled, my reports, to find out that my blood pressure was 220 over 160.
Wow.
Now, I have ran those type of blood pressures.
Wow.
But I was also taking some things that really, thank God, kept my heart muscle strong.
Wow.
And that was the coenzyme Q10, which is very
That's good.
important, essential fatty acid, and some other things as well. So I make sure nutritionally I was doing what I was doing. I was exercising, but I was under a lot of stress. And this is during the time, too, I was going through a divorce.
Wow.
So I tell people, when you're going through a breakup, divorce, having job issues, where you're
Yes.
not happy and you're stressed, or you're dealing with a family member that you're stressed, or a child that's causing you a little bit more stress, anything that's going to offset your day. Because like I said, you could still have a normal blood pressure,
That's true.
and feel great and still have a stroke.
Yes.
So, or a heart attack.
Yes.
So this is one reason why I now have merged the two together, not just doing the beauty shop stroke screening, but also now doing the cardiovascular assessment. And I'm so happy that we have this wonderful machine called the Pulse Max that we will have there at the show. It is
That's
absolutely amazing.
Yes.
So I want to give my wonderful friend here, colleague Doris Mosley. Thank you so much for sharing.
You're welcome.
Thank you.
Yes.
I really appreciate you taking off the time today to share with other people. And while we're doing that, I just want to say I had a very dear friend, and he was under a lot of stress. He lost his business and a lot of stress. And he went home one night, went to bed, and the next morning he woke up and he said, okay, I'm going to turn the lights on so I can get started with my day. But when he turned the light on, he thought that, well, my lights must be off because it's still dark.
Wow.
Not knowing that he had had a stroke in the middle of the night and had gone blind.
Oh my goodness.
Yeah, so I just want to say that everybody's symptoms present differently, but he found this up after waking up. So, and then another young lady, actually we had a tape on it one while. It's on the internet. It's a news commentator, and she was in the process of giving the news of one day, and she actually had a stroke while she was in front of the camera.
Wow.
They watched her have this stroke. So we want to, I'm telling you, it's so imperative that people are there, because hundreds of thousands of people each year are having cardiovascular problems. So the morbidity and the mortality rate is really high. I think we have it there. I would kind of like to show it if you have a second here. I'd like to show her what happens with this lady. You have it there, Jarvis? Yeah. Well, we're going to show a quick little snip of this. That was it? Okay. So, yeah, she's giving the news, and this is what happened. So, and it happened very fast. So the thing is, it's for us to, when we know better, we do better, but it's so imperative. And also, I want to say, too, about medications, because a lot of doctors and practitioners who are not utilizing functional medicine are still giving medication for the treatment. But you want to have some genetic testing done, too, to make sure that the medication that you're taking for your cardiovascular problems, there's not a problem with you to have a side effect from the medication. So there are tests that can be done for your medication, because so many people are still on medication, been on medication, are not going to stop taking their medication. That's a lot of people. But you want to make sure, check with your doctor to see if there's some genetic testing. We know 40% of those medications, there are problems. And it's all the research is there. So just have your doctor to check to make sure that you're on the right medications, and by doing the tests that need to be done to make sure that that's something for you and you don't have a long-term problem. So, Doris Mosley, okay, tell us a little bit more about this wonderful event. And, you know, you've had some experiences too. So
yes.
Would you like to share a little bit, and then, you know?
Oh, of course. You know, Doctor, I'm just sitting here listening to you and saying what an amazing woman you are, simply because you stay on the cutting edge.
Thank you.
You try to help us in advance.
Yes.
See, after the fact, sometimes it's too late.
It's too late, yeah.
And you try to encourage us to get check.
Yes.
And that's what happened to me. I mean,
I know, it's like pulling teeth to get you in there that
oh,
day.
yes. I call you my God of miracle, because you insisted on me that I didn't even come to you that day that I came. I really came for some vinegar.
I know.
And apple cider vinegar. And
Yes.
you said, why don't you get a screening? I was like, no, I didn't come for that. Plus, this was October. April, I had already had a mammogram. So I figured I was fine. And, you know, we as a whole, people, we don't like to know if anything is wrong. So we try to avoid any test. You know, when somebody's looking at the inside of your body, you just feel so open. There's nothing you could do. So I said, no, I'm cool. I got to go. And you said, no, just take it. You said, it's free. Well, Doc, when you said free, that kind of put that's going to put another spin on it, right?
Oh, yes.
So I said, okay, I'll do it. Could I be first? You said, sure, you could be first. So when you asked what part of my body I wanted screened, of course I said, screen my breast, because I had already had that done in April and it was nothing. So I knew you wasn't going to find anything. Sure enough, soon as I sat down, there the dot that indicated it needed to be further checked. And I did, and there it was. It was cancer. It was the big C word. I don't even like to say.
No.
You would say, you had? I said, no, I didn't have it.
How many years ago was that? How many years ago?
11 years ago.
Can you imagine?
I'm into my 11th year. And I was just with a gentleman this morning. He said his wife, hers returned after 5 years. I'm now into my 11th year, and I cannot thank you enough. So anytime you call me to do anything, I'm here for you.
Yes.
But this weekend, you again will be here for us. You're there trying to get people in advance. See, hairstylists, we reach out to a lot of people. I've been in the business this is my 44th year as a stylist, and now I'm also a certified trichologist. So I've gone a little bit deeper into the business, into the beauty industry.
Yes.
But you're going to be there this weekend encouraging people to take 3 minutes, not 3 hours. They won't even miss a class if they just give you 3 minutes of their time to check to see if there's anything lurking in the wall. See, we look beautiful on the outside, but if we cut us open, what do we look like on the inside? And that's what you're trying to get them to see. Not only the stylist, but the stylist to encourage their clients. The clients can come. I encourage you to tell your clients to come by the
they're
Marriott.
coming. That's why I asked you about my list. Yes.
So they can get this test. It's I want to say complimentary. We've seen to move fast on complimentary opposed to free.
Yes.
But she's not charging anything for you to take 3 minutes out of your time that could save your life.
Yes.
That's important. Yeah. So take that time. And when you get this information, whatever it is, act on it. See, some people, I say when I talk to people, some people hear me and some people listen to me, as you will do with Dr. Lee. Some people will hear her, and some people will listen. The people that will listen will be the people who take action. The people that will hear her will just keep walking. They'll even get the piece of paper she may give them as a printout, and they won't do nothing about it. And then later down the line, she will hear what happened. That won't be good. That will be a letdown to Dr. Lee, who has taken out of her time to come to the show. First time. And I go to shows all over the country, and I never see this kind of thing going on where people are being tested for different silent killers. That's what they are. And I don't see that. I don't even see a health room. I don't even see a health nothing. Okay, it's all about the beauty and the other things that they have to offer. But at Spectrum International Beauty Expo, this is not the first year. I remember the one year she had to send somebody straight to the hospital because their blood pressure was so high, they were threatening to stroke out right there at the show that they didn't even know. Dr. Lee was there at the rescue. So we love Dr. Lee. We welcome her every year, not only to be at the show, but she always, and this here stroke screening for beauty shops, she should take this across the country because in our state, we have over 400,000 licensed practitioners, Dr. Lee.
Oh, my goodness.
Do you know how many people they're reaching
Yeah.
that could save a whole lot of lives?
Well, that's my goal, is to start doing the testing at the salons.
And I'll be with you 100%
Oh, thank you so
in
much.
making sure that this get
Thank
out
you.
because my life was saved because of your new equipment that you brought to us, and it saved my life.
Yes.
And if we can save others, hey,
Yes.
one other,
Yes,
that would be a blessing.
it is.
But I
It
know we
is.
can save many others
Yes.
if they just listen.
If you just listen.
They just listen.
And take the time and keep in mind the Pulse Max, or the Max Pulse, is a device that, it's just a finger probe, so I don't have to put anything all over your body. It's just your finger, your index finger going into the probe for just 3 minutes to give me this information. And keep in mind, the pulse wave is a snapshot. It is a snapshot of your cardiovascular health. And that's important. Taking a picture, we know everybody takes selfies and selfies.
Oh, yeah, selfies
But
and
can you imagine
snapshots.
a snapshot to your entire cardiovascular
That's
of who you are
Ooh,
in
that's
just
deep.
3 minutes? And there's so much more information. But come to the booth and find out.
March 18th and 19th, and your booth number is 122.
Thank you.
I know that.
didn't know that.
Yes, your booth number is 122.
122. Okay.
And it's this weekend at the Los Angeles beautiful Marriott. 18th and 19th. You owe it to yourself.
Yes, you do.
You owe it to yourself to take out 3 minutes because let me tell you, no one want to forever take care of a person that's down.
No. And I love the fact that we're going to have the other machine there. So you're going to see that one. See the ultrasound of the
Wow.
carotid artery.
Ooh,
You're
I
going to
wanna
see
do
that
that.
live right there while you're there. You're going to know what percentage. But guess what? Now we can couple it with the pulse wave, which is also going to show me the percent, not so much percentage, but where you are. And it's going to show me if you're type 1, type 2, but are you falling into the others? Those things are very important. People used to tell you the age of your artery. But what's important is the health of your artery. The age is the one thing, but the health of the artery itself is going to give you so much more valuable information to show exactly where am I going with this. So your left ventricular part of your heart, again, it shows you what's going on there. It's so much information that's put into this that is totally amazing.
Well,
The
I
percentage,
definitely want to do
it's the
it.
number one killer.
I believe you.
Number one killer. So why don't we do something? I'm here to help you. I was blessed to come back from the second coma. And we all have a purpose for our lives. And I do know beyond a shadow of a doubt, this is part of my purpose for my life.
Yes.
So it's important that you come. Let me do my gift. Don't stop me from doing my gift now. Come and let's test you.
Yes, I will be tested.
Yes. Because, a test is more than anything. And like I say, it's so quick. Yes.
Okay, when they get this test done and they get the results of the test, do they take it to their medical doctor? How up on this on the medical doctors or the medical world? 'Cause,
They can take it to their medical doctor because this is a device that was designed by cardiologists.
Okay.
So this is not just a a tool that people use and kind of holistically or whatever. This is a medical device. So there are medical doctors involved. That's why I mentioned the medication, because some of the people who are utilizing the pulse, the max pulse, or prescribing medications, and some will do functional medicine. So what's important, if your artery is stiff, then what do you need to do? If you have these things going on, if your blood pressure is elevated, lifestyle change is number one.
Yes.
You've got to, come to the conclusion, I am going to do something to change my lifestyle, which is number one. And with heart disease being the number one cause of death in the United States, number one, you owe this to yourself. So you want to bring out your loved ones. It's going to be fun. The hair show is always a lot of fun as well. Find out the latest techniques. She's going to give me a new hairstyle one day. I've changed up a little bit. She hadn't seen
I have
this
a
look.
new one today.
Yes, you do. So it's so important. But the mortality and the morbidity rate, meaning that if you survive it, what about the disability from that?
Yes.
If you're going to be paralyzed, if you're going to be incontinent, who takes care of you? Who takes care of your children if you're a single parent? Who is going to be there for you? So you owe it to yourself to take care of yourself.
Yes.
Really love yourself and take care of yourself. If you love yourself, you're going to be there. It's a Spectrum International. You can come by bus, plane, skate, walk, just be there.
Getting off the airplane, you could just walk right on over.
You can walk right on over because we're right there. So it's important that everyone show up for this, because sudden death, half the victims who have cardiac problems will have sudden death. And like I said, a lot of times there's no symptoms at all. And this is happening in 20-year-olds too. So that inflammation marker is important to know. Like I said, this is not the only one. So you might need an echocardiogram from here. I would not say this is the only thing you have. So if you want to take a report to your doctor, he might want to take it from there and say, let's do the test. Let's do the blood test. But if you want to be proactive, if I had a test that came out and it was showing something abnormal, I'm going to call Life Extension. I'm going to order the lab work, because you don't need a doctor's prescription to order it. You can just go online and order it yourself. If you have any questions about that, don't hesitate. Just give me a call at the clinic there. So it will be posted, and give us a call. People who are listening on the radio, just keep in mind that this 1 minute test, 3 minute test, can save your life. The phone number is 310-929-2408. Again, give us a call to set up your appointment. If you miss the expo, keep in mind we do provide this in our clinic at 310-929-2408. 929-2408.
Is that it on the screen? It's not. That's not.
292-2408.
Oh, okay.
So that is the phone number. So we do have a separate number, which is 310-419-4300. So there's a second number. But call this number is a lot faster, and I will receive the calls, get your appointment set up. Come into the clinic. When you come into the clinic, unfortunately, it will not be free, but it will be affordable. So please take advantage of this weekend, because it will be free. So if you're listening through iHeartRadio, if you're listening through so many other divisions that we have here, and UBN Radio, I just want to say, please take advantage of this. If you do not take advantage of it, please call us. I will work with you on something that will be affordable for you. And keep in mind, you won't be there all day. It'll just be a few minutes.
And Dr. Lee, another booth they could stop by is Healthy Place Botanicals will be there also.
Yes,
so
which I'm part of them too.
That's right, Dr.
I'm
Lee
part of them
right
too.
In that area,
and now Alicia is going to find out some information, and she and her family are going to be involved. Well, she's coming to the expo as well.
Yes, I'll be there.
She's going to be there helping me, because I'm going to need a little help there, but not much.
Very good. We just encourage everybody, Dr. Lee, to just don't sleep on this. This is too important for us as a group of people, because they always say we're number one, finally, but it's always in heart attacks, strokes.
Oh yeah,
we don't want to be number one.
I worked at a level trauma level.
Am I right, Alicia? We don't want to be number
No.
one. We don't want to be known for number one in heart attacks and strokes.
No,
Exactly.
and
Because of our lifestyle.
Working at a level 1 trauma center here in Los Angeles and level 1 trauma is where you see some of things happening to people I was told if I could last there or stay for 6 months, it was equivalent to 2 years of combat.
I can believe that.
So, and I did last, but I'm telling you, it was what happened there, is seeing people wait till the last minute on the medical side. The trauma side was totally different, but the medical side, seeing people come to the door. The saddest case I have ever witnessed was 3 young girls, starting at age 10 all the way up to 14. It looked like they had made a wheelchair almost for their grandfather, and they didn't live far from the hospital. And I guess the grandfather had said, "I don't feel well," at some point. And while they were bringing the grandfather in, by the time they arrived at the ER, I was standing near the door because I was working near the triage component. I could see he had already passed away, and they didn't even know it. So I'm just saying,
Wow.
please take time. I don't know how much I could stress this. I just lost a very dear friend of mine last year from a broken heart. And we know it's called broken heart syndrome now. There is a medical terminology for broken heart. So broken heart syndrome. So if you're there at this event and you know within yourself you're going through something, please stop by the booth. My booth number is
122.
122. So please come by. There's going to be a health panel that's going to be happening there
On Sunday.
So
Yes. And a hair loss panel.
Yeah,
Talking
hair
about
loss
hair
panel.
loss.
So
We have,
anybody, this is a health expo.
Yeah.
So hair loss, people who are having problems, please be there. And
Dr. Marcia Glenn is
It
on that
is-
panel.
yeah.
And Dr. Gloria Morrow, she's a psychologist because losing hair can be very traumatic.
right.
She's on that panel. And Connie Judge, she's a trichologist. She'll be on that panel. I will be on that panel. Gigi, a girl out of Oakland, and Sharon Reams out of Arkansas will be on that panel.
Okay. Now, I
So-
should be on that panel speaking of
I
the
think you
nutritional.
are. I think you
nutritional
are, Dr. Lee.
aspect of
I think you are
Yeah.
on that panel.
Yeah,
Connie put it together. I think you are on that panel.
It's just getting things
But,
to people on
yes.
nutritionally, because nutritional
Yes.
aspect and hair loss is something very important.
It does go together.
So I just want to say that I would like to give my wonderful guest here, Alicia, if you can give us something like in 30 seconds of your beautiful
wow.
opera voice.
Oh,
Ooh,
great.
Okay.
What
Okay.
a treat.
Yeah.
This is Chi bel sogno di Doretta. It's an Italian aria. Chi bel sogno di Doretta poté indovinar, e fu quel bacio rivelazione, fu la passione. Selfine rifiorita la felicità, o sognerò poté amar così.
Wow.
That was music. That was
Thank
music
you.
for the heart. Thank you so much.
Thank
Music
so
for the heart. I could
much.
just feel my heart feeling happy
God,
and
that was
relaxed.
awesome.
Thank you.
You know, because music is soothing.
It is for the
and
heart.
meditating
Oh,
for
that was
relaxing
awesome.
that your stress level. So that was
Yes.
very good. Thank
Thank
you
you
so
so
much for that
much.
soothing.
Very
Thank you for
good.
having
Thank you.
me.
Thank you. And Doris Mosley, we have a couple of seconds left here. Now, I want you to look into the audience eyes and tell them why it's important and imperative that they are there at the International Spectrum Beauty Contest. You can do this in 1 minute. I'll be happy.
Yes. It is so very important that you come out this weekend. Just a little bit of your time will make a major difference in your career. I don't know whether you want to, what you want to do, where you want to go, but Dr. Lee is taking out of her time to make sure we remain as healthy as we possibly can be. And I'm asking you to come learn the techniques that are being shown there this weekend from different hairstylists, from manufacturers. We welcome each and every one of you. Just make sure you are 16 years and older.
Great.
And I want to thank everyone, and I just want to tell you, please take time out of your busy schedule and know that prevention, the preventative approach, is the approach for heart disease, is for longevity for you. And what you don't know can kill you. So you want to know everything there's possible to know about yourself. We can be walking around and feeling great today, and we keep hearing this in the media. Person was walking around, looked great, and all of a sudden we hear they're no longer with us. Please do not let that happen to you. You do not have to have symptoms to have cardiovascular disease. So please come and have your screening here at the 15th annual Spectrum International Beauty Expo. I'm looking to see you there. We're looking to have long lines, but you won't be in the line for very long. Get your test done and move on. But this is something that's life-saving for you and your family. It's very imperative that you're there. As I always end my show, and it's very important that everybody repeat after me. I am so grateful that I am a magnet for miracles. And those miracles start right here, right now.
Yes.
And feel that in your spirit and in your soul. Take it into your heart. The miracles start right now, right here. We'll see you at the Spectrum International Beauty Expo. If you missed the expo, give us a call at our clinic at New Wellness Healthcare. And I want to thank everyone here at UBN. I want to thank Jarvis, who is my wonderful producer, all those wonderful pictures that he just worked so diligently and make sure that you can see them. We will see you there. Come out. You'll meet Jarvis. He's going to be there one of those 2 days. So come out and meet Jarvis, okay? He's absolutely amazing. So I want to thank my guests again. Alicia, thank you so much for being here, sharing your story.
Yes.
Doris Mosley, one and only Doris Mosley. You're known internationally. So I just want to thank you. And you also, in your skill, have, taken it to another level and another level. So I just want to thank you. Thank everyone. Tune in next week. Until then, love yourself, but love someone else too.
Yes.
Join us every Wednesday live at 11 a.m. for New Wellness TV with Dr. Lee. Remember, healthy mind, healthy body.